Okay, hello everyone. So today we are going to discuss anatomy for the AFK exam dental. AFK is assessment of fundamental knowledge, as you all know. There are some other exams like ADAT. ADAT exam is used for admissions in various universities across Canada and United States. And the third exam is NEET exam, which is conducted for Masters of Dental Surgery, MDS in India. So we'll be starting with some of the basics. The first topic which we'll be discussing is embryology. So let me start with embryology. Now, if we talk about embryology, we'll be discussing about the general embryology, where we'll be giving I'll be giving a small introduction followed by fertilization, morula, blastocysts, and other things. We'll be discussing about development of phase, which is our main topic. And then at the end, we'll be discussing some of the applied aspects and the references if you want. Okay, now the first thing which we should know is what are gametes. Now, as we all know, the cells that carry out the specific function of reproduction are known as gametes. Now, they're male gametes known as spermatozoa. The process by which they are formed is known as spermatogenesis. Female gametes are known as ova, and the process is known as oogenesis. The two commonly we can call gametogenesis. Now, the growth and development is divided into two categories, prenatal and postnatal. Okay. Now, the prenatal is before the birth of the baby. The ovum stage, so 1 to 14th day is known as ovum. Sometimes, they ask you a very basic question that these days are very important. So they ask you basic question, what is the time period of ovum, when we call it embryo and when we call it fetus. So sometimes you should remember that embryo starts from the 14th day till 56th day, and fetus starts from 56th to 280th day. Then there is postnatal development, which we'll be discussing afterwards, that after the birth, what all changes, for example, the age changes of the mandible, that is also one of the concepts which we have to understand. And there are a lot of questions based on that. Okay, so we will be discussing about how the fertilization occurs. Then there is a morula, blastocyst, bile minor, germ disc, followed by the gastrulation, notochord, germ layers, and branchial arches and pouches. Now, this is a basic that what all stages are there. We'll be discussing each and every stage in detail. Starting with the fertilization. The fertilization takes place when spermatozoa enters, the ovum, and the fused ovum and sperm is called as the zygote. Sometimes they ask you a question, what is the meaning of one-celled embryo? So what is one-celled embryo? It is known as zygote. Now, whenever I'm teaching, just take care of what we are reading right now. I'll be asking questions in between. These are very basic concepts. The questions will be very easy. Okay, so I'll be asking questions. So just be attentive. Now, where does this fertilization takes place? It takes place in the ampulla of uterine tube, right? Now, we'll discuss where it is located, the ampulla of uterine tube. There the fertilization is occurring. Okay. This is a small video which we'll see in some time. Let me just go ahead first. Okay. Now, once the fertilization occurs, that is the one-celled stage is done. What do we call this one-cell stage? Anybody? Neha?
Zygote.
Yeah, zygote. Yes. So that is known as the zygote. Okay. Now, fertilization. Now, after this fertilization, what is happening is there is a process known as cleavage. Cleavage is a type of mitotic cell division. Okay. So within 24 hours of fertilization, these mitotic cell divisions occur, right? They start, right? So from one cell, it becomes two cell. From two cell, it becomes four cell. From four cell, it becomes eight cell. So it goes in these stages like two cell, four cell, eight cell, different stages. These divisions are not accompanied by cell growth. So if you see, the size of the cell is same. So they are just dividing in between the same size of the cell. Okay. So they are not accompanied by cell growth. So they subdivide the large zygote into many small daughter cells. Now these small daughter cells are known as blastomeres. So these small cells. So this is an 8-cell stage. All of them are called as blastomeres. Now this cleavage proceeds, and there is a cell which is 16-cell stage, This stage, we call it morula. So morula because it looks like a mulberry. Now, what happens, this morula stage, what happens in this stage, that it is divided into two parts. The inner part, which is known as the inner cell mass, and this outer layer of cells. Now, the outer layer of cells gives rise to trophoblast. Now, we can say the trophoblast is giving nutrition to the embryo. So, if I say embryo, so this inner cell mass is going to give rise to embryo. Okay. So it is going to give rise to embryo. And the outer mass is known as the trophoblast. So this embryo will take nutrition through this trophoblast. We'll see in a little bit of while this trophoblast is also divided into two, syncytio and cyto. So we'll discuss about that as we go ahead. Now this inner cell mass give rise to embryo proper. Okay, so they are called as embryoblast. Blast means forming cell, right? So they are called as embryoblast. Any confusion till now?
No.
No? Okay, good. If you have any confusion, just stop me in between, okay? Now, blastocyst. Obviously, blastocyst means that a cavity is created now. So, as the morula, acha, okay, tell me, how many cell stage is morula? Anybody?
16.
Very nice. 16 cell stage. As the morula enters the uterus on the third or the fourth day after fertilization. Now, what is happening? If I make a very small diagram, right? Okay. Now the fertilization is taking place in this area. Okay. After this fertilization, the morula is formed, right? Right. So what is happening is when this morula, it goes into the uterine cavity, and at a certain stage, which we'll be discussing, it gets implanted here. So it goes inside from here. Okay. So it drops down from here, right? So the fertilization is taking place here. What we were discussing about the fertilization. This is taking place into the ampulla of the uterine tube. So these are the two uterine tubes. This area is the ampulla. So the fertilization is taking place here. After this, there are multiple divisions which are occurring, morula is formed, right? So at this stage, at the third or the fourth day, what happens is a cavity begins to appear. So when a cavity is beginning to appear, it gives rise to blastocele, which is filled with fluid from the uterine cavity. So there is a lot of fluid here which gets filled inside this morula. Okay. So at this stage, we call the morula as blastocyst, right? Now what is happening when fluid is coming, that inner cell mass which was there, anybody who can tell me the inner cell mass gives rise to what?
Embryo.
Embryo. And the outside there was trophoblast, right? Trophoblast. So what is happening? That fluid comes in between these two, right? And we call it blastocyst. Okay. Now, many events are occurring during the second week. So second week is very, very important during the development. Now, the embryoblast. Embryoblast is the inner cell mass which is giving rise to embryo. So we call it embryoblast, right? Because it is giving rise to embryo. Now it splits into two germ layers. Now the two germ layers are epiblast and hypoblast. Okay. Now, any idea like epiblasts? Epi means it is giving rise to ectoderm. Hypo means lower. But there is a very interesting concept that everybody thinks that epiblast give rise to ectoderm, hypoblast should give rise to endoderm, and there is a mesoderm which is formed in between, right? But actually it doesn't happen like that. Actually, epiblast only gives rise to all the three germ layers, ecto, meso, and endo. How we'll discuss in detail, right? So this is very important to understand because sometimes there is a question in the exam that which germ layer gives rise to ecto, meso, and endo. That is the epiblast. Okay. So always remember that epiblast is the source of all the three germ layers. We'll discuss in detail, don't worry. Now this trophoblast is divided into or giving rise to two tissues, cyto and syncytio. Okay, so cyto, trophoblast, and syncytio, trophoblast. There is a very beautiful diagram which I have taken from the book 10 Kates. It is a book of oral histology. Now, any diagram from this book, like you will love those diagrams because just by looking at those two diagrams, you'll be able to understand all of the like almost all of the embryology. It's a beautiful diagram, right? So we'll see that diagram in a while. Before that, let's see that this blastocyst cavity, the blastocyst cavity is remodeled twice. First, it will form the primary yolk sac, and then it will form the definitive yolk sac. There will be two cavities formed, amniotic and chorionic. Sometimes we call it amnion and chorion. Okay, so we'll discuss how they are formed. Now, this is very, very important that the inner cell mass we have discussed is divided into two layered. Now, at this stage, we call it bilaminar disc. So these are week 1 and week 2 of the development. So always remember week 2, bilaminar. Okay, bilaminar. Bilaminar means epiblast and hypoblast. Okay. Now there's something written at the bottom which you might be thinking, what is this? So let's see the diagram. Okay. Now this is the most beautiful diagram I've ever seen and very informative. Now in this diagram you will see this is the epiblast. So the blue colored here, this is the epiblastic layer. Now if you see there is a cavity which is formed in this epiblast as well. This cavity is called as amniotic cavity. Now, if you see hypoblast, which is yellow colored, this is the hypoblast. Okay. Now, there is a cavity which is formed in the hypoblast as well, which is known as exocoelomic cavity or primitive yolk sac. Now, can anybody tell me, like, if you see at this picture, if you see it is known as fibrin coagulum. Can anybody tell me what is actually happening? Like, at this stage where where it is located or what is happened, why is there a fibrin coagulum here? Anybody, if you know, any idea? Neha, are you there?
Yeah.
Any idea? No. No. Okay.
Fibrin coagulum is there to the collagen
Yeah, so I'll
formation.
tell you
So
what has happened here. Okay. Now, as I showed you this picture where from the uterine tube, it drops down in the uterine cavity. Now, what happened is it gets implanted here. Okay. So when it gets implanted, it goes inside, right? So when it goes inside, this membrane, it ruptures, right? This membrane ruptures. So when it ruptures, it is actually repaired. So that is the reason here there is a fibrin coagulum. So from here, the embryo has gone inside the like the membrane, okay? The uterine membrane, okay? So this is the uterine membrane and it has gone inside and all these structures are formed. Now it is resting here, right? Right? So at this stage, it is resting inside. Okay. Now, these, if you see these trophoblast, it is divided into cyto and syncytio. Okay. So the first layer is known as cyto and the outside layer is syncytio. There are some lacunae formed inside. Okay. Now, what is the lacunae? What is their feature is that there are some blood vessels which goes inside these lacunae. And at this stage, there is a very primitive circulation which is developed between the embryo and the body, right? Because obviously the embryo needs proper nutrition from mother to grow, right? For this, it is happening. So, placenta. So this actually gives rise to placenta, right? Now this trophoblast, which is divided into cyto and syncytio trophoblast, it is having a primitive blood circulation, right? So this blood circulation is coming inside to give nutrition to this developing embryo, which is divided into epiblast and hypoblast. In the epiblast, we have a cavity which is known as amniotic cavity. In the hypoblast, we have a cavity which is primitive yolk sac and exocoelomic cavity. When we used to study, like during our college time, these structures like amniotic cavity, primitive yolk sac, they used to be very confusing. But just by looking at this diagram, it's very easy to understand, right? Am I right?
yeah.
Yeah. So this is giving us a very beautiful picture and very informative picture, right? And I'll be asking questions about it in the future. So just be attentive, okay? Okay, now the syncytial trophoblast invades the endometrial connective tissue and erodes the capillaries. Erosion of the endometrial blood vessels causes maternal blood to flow into the cavities or lacunae within the syncytial trophoblast. What I was telling about, right? So the maternal blood flow is flowing inside the endometrial blood vessels. Okay. Now, this blood flow represents a primitive circulation, right? This circulation is known as uteroplacental circulation, right? This is a type of primitive circulation. So sometimes they ask you a question about the uteroplacental circulation. Now, I know that these are like very primitive circulations. The questions are not very common from this particular topic, but this is very important to understand. Sometimes what they do is they put these things into the options, right, of the question. So if you know about the concepts, the basic concepts, if there is a question you understand, you can rule out. Sometimes you cannot, nobody can know everything in any exam, right? So sometimes what happens is if you have good knowledge about other things and there are four options, at least you can rule out two of them, that this will not be the answer of this question, right? And the probability of getting the correct answer is 50% in this, right? Rather than getting a
Elimination
probability of
risk.
25% or 5%, right? So getting some knowledge, understanding the basic concepts will give us an extra edge, right? And these are the basics of embryology. They will help us to understand. Okay. Now, amniotic cavity appears on the day 8 as fluid begins to collect between the cells of epiblast. Although amniotic cavity is at first smaller than the blastocyst, it expands steadily by 8th week, so which we'll see later. Now, this is another picture, right? Here, the cavity has expanded. If you see that there was a primitive yolk sac in this cavity, right? If you remember, the hypoblastic cell was having a primitive yolk sac, right? Or the primary yolk sac. Now, sorry, primary yolk sac. Now, this primary yolk sac converted to secondary yolk sac. Why? Because there is another cavity which is formed outside, right? Now, this cavity is called as the chorionic cavity. Now, you remember the amniotic cavity, hypoblast, the chorionic cavity, which is also known as extraembryonic coelom. Okay. Sometimes there is exocoelomic cyst, which is developed, right? Now, these are the maternal blood flow, which we all know. Now, one thing is formed here, which is known as the connecting stalk, right? So the connecting stalk, if you see, it's a very faint. Are you able to see this?
Yes.
Okay, so this is a connecting stalk. Okay, so this is connecting the embryo with the maternal blood. So the embryo is taking nutrition through this, right? So kind of like placenta, right? The future placenta. Now, at first, the walls of the amniotic cavity and yolk sac are in contact with the trophoblast. They are soon separated by extra embryonic mesoderm, lacunae filled in this extra embryonic mesoderm. Then they are fused to form the chorionic cavity or extra embryonic coelom. So now we have few more concepts. We know about chorionic cavity, we know amniotic cavity, we know what is secondary yolk sac, what is primary yolk sac, right? What is maternal sinusoid? The trophoblast is divided into cytotrophoblast, and you can keep your mic unmuted so that I can keep you asking, so
Syncytiotrophoblasts.
that I know you are not sleeping, right? Right?
Yeah.
Sleeping?
No.
No? Okay. What is the name of this? Syncytiotrophoblast.
Syncytio. Yeah.
Syncytial.
Syncytiotrophoblasts.
I'm not very good in pronunciation, but it's syncytiotrophoblast, and this is the cytotrophoblast. Okay, you remember, right?
Yeah.
Okay, good. Now this is a previous stage. So in this stage, what they have shown is that there are some lacunae formed before the fusion, right? So if you see in this picture, the lacunae have fused and there is a cavity formed. So this is just a continuation of that. Okay. Now, this extra embryonic coelom, it splits the extra embryonic mesoderm into two types of mesoderm, the somatopleuric and the splanchnopluric mesoderm. Now, the splanchnopluric mesoderm is lining the yolk sac, and the somatopleuric mesoderm is lining the cyto and the amnion. So, which we'll see in the diagram. Now, we have already seen what is chorion. Okay, now sometimes there is a question. This is like, there was a question which I have seen. Let me just show you what was it. what is chorion? What is chorion? Okay, so the trophoblast and underlying somatopleuric mesoderm. Let's see. Let's see where they have the, yeah. So here, if you see, this is the splanchnopleuric mesoderm and somatopleuric mesoderm. So here we have the somatopleuric and here we have the splanchnopleuric mesoderm. Now let's see, the somatopleuric is cyto and amnion. So if you see the somatopleuric, now if you see, this is the cytotrophoblast, okay, right? The outer one. Now, in between the cytotrophoblast, you see this mesoderm is known as somatopleuric mesoderm, right? And the inner one is known as splanchnopleuric. So just to remember, somato or outer, you can remember like this, okay? Splanchno or inner. Because somato has a T, somato outer. They are rhyming, right? Splanchno is inner. So always remember one, the other one is opposite, right? So if you remember this, that it is outer, and we remember that the cytotrophoblast is like it is separated, right? So the outer one should be lining the the cytotrophoblast. Okay. So if you want to learn the definition of chorion, we have the somatopleuric mesoderm, the outer one, right? Because the chorion is formed by the outer one, outer mesoderm. The cells forming the amniotic cavity forms the amnion. Okay, the amniotic cavity is now attached by the connecting stop. Okay, so this is again, this is a very good picture. Here also we have the somatopleuric mesoderm. So there is a faint image of this mesoderm. If you see, there is a faint image. Let me just highlight this if you are not able to see.
It's visible.
So this one, okay. So inside the cytotrophoblast, this one is the somatopleuric mesoderm. Okay. Just put the pen again and get out of it. Okay. Next. Okay. Now, sorry, I have to delete what is there on the screen. Just give me 1 minute. It's done. Now the next process, now we have come to week 3. Okay. In week 2, everything was 2. In week 3, everything is 3. Very simple to learn, right? Now this bilaminar embryonic disc, it gives rise to trilaminar disc, which is known as gastrulation. So what is gastrulation? The formation of 3 germ layers. 3 germ layers, okay, is known as gastrulation. Now there is a formation of procaudal plate. So what is procaudal plate? It is a localized area of thickening of hypoblast at the cranial end of the bilaminar disc. Now, when the second week is ending, what happens is there is a localized area of thickening which occurs in the hypoblast at the cranial end. Now, you might be wondering now where this new word cranial end is occurring, has come. Now, cranial end means where the future brain is developing. So there is a cranial end and a caudal end, which we'll be discussing further. So where the brain is developing or the neural tube forms and the brain forms, that is known as the cranial end. So if you see in this picture, I think we have seen this picture many times in our books like in the Beer Singh, if you remember, right? So this is the cranial end and this is the caudal end. Okay. Now what is happening? near the cranial end, there is a formation of procaudal plate. So this is a small thickening which is formed near the cranial end, right? And near the caudal end, there is a streak or the line which is known as the primitive streak, and there is a bulging around. Okay. Now, if you see, this is the wall of the amniotic cavity which is removed to show this picture. So what they have done is the amniotic cavity, the wall is removed, and we are seeing it from the inside what is happening. So it will be more clear in the next pictures, right? Now what is happening? There is a small node which is formed at the cranial end of the primitive streak. So whenever we talk in embryology that where this thing is happening, we talk in terms of cranial and caudal end. Okay, so at during the towards the cranial end of the primitive, there's a primitive streak. Towards the cranial end, there is a primitive node which is formed. So what is primitive streak? It is a narrow trough-like structure with slightly bulging sides that develops in the midline of epiblast towards the caudal end. So if you see that primitive streak has formed towards the caudal end. Okay, and the primitive node is elevation surrounding the primitive pit located at the cranial end of the primitive streak, right? Because sometimes some students, they get confused with this, that what is this cranial end, what is this caudal end, we are getting bored, we are not able to understand. So this is just that cranial end means towards the cranial side. So it is towards the cranial side. If we talk something which is happening this side, this is the caudal side. Now the next process is known as invaginations. Okay, now let's understand that how the three germ layers are formed. Now, this is a very important question which is asked, that the source of three germ layers. Okay, so Neha or Aman, anybody who can tell me what is the source of three germ layers?
Epiblast.
Epiblast, yeah. So this is the epiblast, the outer layer. Okay, now what is happening, that there are some invaginations occurring. So the cells are actually moving or migrating and sort of like going inside from this epiblast. Now, if you see very clearly that the cells of epiblast are replacing the cells of hypoblast and giving rise to endoderm. Okay, so epiblast is forming all the three germ layers, even the endoderm. And in the second picture, you see this is the mesoderm. So some of the cells of the epiblast, they migrate to form the mesoderm in between. Some of the cells, they migrate below to form the endoderm. Okay, so after invagination, some epiblastic cells displace the hypoblastic cells, creating the embryonic endoderm. Others come to lie between them, forming the mesoderm. Okay, so at this point of time, we have to understand that there are some invaginations which are occurring, right? And the epiblastic cells, they displace the cells of the hypoblast to give rise to endoderm and mesoderm. Okay, this is the gastrulation. Again, if you see the definition of gastrulation, formation of trilaminar from bilaminar disc, or week 3 of the development, forming ectoderm, mesoderm, endoderm, right? So now we know what is primitive streak, primitive node, what is happening, epiblastic cells are moving. This is the bilaminar embryonic disc, and how the cells are invaginating and going inside and in between and forming mesoderm, endoderm, and ectoderm. Okay. Now we are at week 3. These are the various derivatives, but again, I will just give you a picture where we'll be understanding all the things together. Okay. Before that, let's see that what happens after gastrulation. Why we are reading this before the derivatives is because a very popular question which comes in the exam, and it has been asked multiple times, and it is a favorite topic for all the examiners, be it like AFK exam, ADAT, or NEET exam. Any exam, this is a favorite topic. So after this session, what we are going to do is, not after this session, in the future session or in the next session, we'll be having some questions from various sources, like the released questions, right? So we'll be discussing questions from dental decks, from Caution questions, MCQs, and there are multiple other books. So we'll be doing some questions from there, and we'll be discussing that you will be seeing that there are a lot of questions which are asked from these neural crest cells, okay, especially from embryology. So the favorite topic from embryology is neural crest cells, and the second is pharyngeal arches and pouches. So pharyngeal arches and pouches, we have to learn by heart each and every concept, each and every point, but these neural crest cells are very important, okay? So, but we should know what are these neural crest cells, right? So formation of neural tube and neural crest cells from the ectoderm. So technically, they are formed from the ectoderm, okay? Now the mesoderm, which we were, seeing, it divides into three parts: paraaxial, lateral, and intermediate. So divides into paraaxial, lateral, and intermediate. Very rare, not very rare, in our dental exams, sometimes they ask questions about the derivatives of these particular divisions of the mesoderm. Sometimes they are in the options, so we should know what are the derivatives of these individual uh, differentiated mesoderms, right? Now, there is a concept which is known as folding of embryo. Now, the embryo folds in two planes, rostrocaudal and lateral axis. So if you see, this is the head side or the cranial side, and this is the tail fold or the caudal side. These are the lateral sides. So if you see me, so what is happening? Let me show you with a paper. Okay. Now, if you see this paper, right, you can just fold this paper like this, right? Or you can fold this paper like this. Okay. Are you able to see the paper? Neha and Aman, are you able to see the paper?
Yes.
Okay. Aman, are you there? Aman sir, are you there?
Just driving also, that's why.
Okay.
Sorry.
Okay. No problem, sir. No problem. Okay. So it is folding in two axes, right? The head to tail, right? And the lateral side. Okay. So the similar thing happens with the embryo. It is folding in two planes, rostrocaudal and lateral axis. Okay. Head fold is critical to the formation of stomatodium. Okay. Now, stomatodium is the future oral cavity. Now, most of the times we read about this stomatodium, the buccopharyngeal membrane. Buccopharyngeal membrane is also very important to understand, right? So we'll be discussing about buccopharyngeal membrane. What is it? Now, in some of the questions, you will see they call neural crest cells as a fourth germ layer. Actually, it is not, but they consider it because, you know why? Because even the neural crest cells gives rise to a lot of derivatives, right? So sometimes they call it fourth germ layer. Now, the neural tube. The neural tube is formed from the ectoderm, which is overlying the notochord. We have skipped the part of notochord. We'll see in a little while that notochord is formed. Now, the neural tube grows. As the neural tube grows, the neural crest cells are formed from them, right? So as the neural tube is growing, there are some crest cells on the top. Some of the cells, they just detach from the neural tube and they give rise to some structures. Okay, they can be distinguished, differentiating and separating at the crest of the neural folds. Hence, they are known as the neural crest cells. These cells have the capacity to migrate and differentiate. Okay, they differentiate to most of the connective tissue of the head. So you can say the most of the connective tissue of the head, which is our bread and butter, right? We are mainly dealing with head and neck, right? So they are the neural crest cells. That is the reason any topic which is popular amongst the examiners, it's related to head and neck. So if we talk about any basic subject like general embryology, general anatomy, anything which is related to head and neck region is important because this is our bread and butter. We'll be conducting surgeries of head and neck. We'll be doing everything in head and neck region, right? But we have to know other things as well because sometimes we have a lot of complications in our clinics, right? So we have to understand those things, but these are very important. Okay. Now this, if you see the 10 Kids Oral Histology book, I loved this diagram and I took it from that particular book. And if you see that this diagram alone is sufficient to understand all the derivatives, all the germ layers, neural crest cells, everything in one picture. So at the end of this lecture, I'll share this picture with you so that you just stick this picture in front of you anytime you want to just review all the derivatives. It's one picture and it's good to go. Okay. So let's start. And now I'll be asking questions once I complete it. Okay. Okay. So be attentive. First, let's learn the neural crest cells, are most important one. Okay. Now, the cranial and sensory ganglia and nerves, very, very important. The cranial and sensory ganglia and nerves. We'll be reading about all the cranial nerves, all the ganglia in detail. Then adrenal medulla, then ectomesenchyme, then bones and skull, then dentine, periodontal ligament, and alveolar bone. At this point, I'll just take a break of 2 minutes. I'll just be back in 2 minutes. Okay. Sorry, I'm back now. You're all there, right?
Yes.
Okay. Okay. So cranial and sensory ganglia and nerves, adrenal medulla, ectomesenchyme, right? Bones and skull, dentine, periodontal ligament, and alveolar bone. Okay. So always remember all of these. Okay. So this is very, very important. Now, if we talk, what structures of the tooth are developed from neural crest cells, Neha?
PDL,
Yeah,
dentine, alveolar bone.
very nice. So PDL, dentine, and alveolar bone, right? So they are derived from the neural crest cells. Okay, very nice. Now, the cranial nerves are derived from neural crest cells. The adrenal medulla is derived from neural crest cells. Ectomesenchyme, we'll discuss about ectomesenchyme. What is it? Okay, why we call it ectomesenchyme, not ectomesoderm or anything. Bones, right? Skull, dentine, PDL, and alveolar bone. I'm repeating it again and again because these are very, very important. Okay. Now, there is another layer of the ectoderm, which is known as the neuroectoderm. So this ectoderm, if you see, the upper portion is known as surface ectoderm, which is on the surface. Then there is a neuroectoderm. These are the crest cells which are migrating. If you see the arrows, so they are known as the neural crest cell, these dots. This is a mesoderm in between. So let me first explain. This is ectoderm, this is endoderm, and this is the mesoderm. Okay. So this is mesoderm, endoderm, and ecto. Ecto means surface. Okay. Now, this, apart from this, we have the neuroectoderm and the neural crest cells. So these are the neural crest cells, these ones, and this is the neuroectoderm. Okay. Now let's see what all structures are formed from the neuroectoderm. The neuroectoderm gives rise to posterior pituitary, pineal body, PP. Then we have retina and central nervous system. Okay. Now next we have the mesoderm. If you remember, the mesoderm is divided into lateral plate, intermediate plate, and paraaxial mesoderm. The lateral plate gives rise to connective tissue, which is known as mesenchyme, muscles of viscera, serous membranes of pleura, pericardium and peritoneum, blood and lymph cells, cardiovascular and lymphatic systems, right? Adrenal cortex. So if you sometimes get a questions, now adrenal cortex is given like it, the lateral plate forms the adrenal cortex. So the source of adrenal cortex is the lateral plate. It is a mesodermal structure. Okay. Now, Neha, can you tell me, adrenal cortex is formed from lateral plate of the mesoderm, right?
Yeah.
Adrenal medulla is formed by which structure?
Neural crest cells.
Very good. Now, the intermediate plate, it gives rise to urogenital system. So if you see most of the connective tissue, so mesoderm is the connective tissue. Most of the connective tissue is formed from the mesoderm. Okay. So like the heart, right? The blood vessels, lymph vessels, cardiovascular system, adrenal cortex, connective tissue, right? The paraxial gives rise to muscles, right? So muscles is again like the connective tissue, muscles, they are all formed from the mesoderm. So paraxial is muscles of the trunk, skeleton, except skull, which is formed by Neha.
Sorry.
It says muscles of the trunk skeleton except skull. Why
Skull
except
is formed
skull?
by neural crest cells.
Yes, dermis of the skin, connective tissue, mesenchyme. Okay, so these are all dermis of the skin is also formed from the mesoderm. Now, if we
Mm.
come to the endodermal structures, okay. Now, endodermal structures are epithelial component of the trachea, bronchi, and lungs. Okay. Then we have epithelium of the gastrointestinal tract, GIT. Then liver, pancreas, urinary bladder, and um, urachus. I'm not sure
Yeah,
what is it. Sorry.
urachus.
Urachus, okay. Epithelial component of the pharynx, thyroid, tympanic cavity, pharyngotympanic tube, tonsils, and parathyroid. Okay, so these we have to know. Although not many questions you will find in EFK exam because it is more nowadays it is more related to clinical aspect. But yes, this is important because sometimes there is a possibility of getting a question based on the derivatives, and you should know. Okay. Then the surface ectoderm, obviously, surface ectoderm gives rise to epidermis, hair, nails, cutaneous glands, mammary glands, anterior pituitary gland, parenchyma of the salivary gland, enamel of the of the teeth, lens, and inner ear. Okay. So the enamel is formed from the surface ectoderm, whereas the dentine, PDL, and alveolar bone are all formed from the neural
Neural
crest cells,
crest.
right? So this is very, very important that surface ectoderm gives rise to the enamel of the teeth. Okay, so I'll be asking questions once we go ahead. Okay, now this is how the neural plate is formed, okay, or the neural tube is formed. So if you see, this is just the folding, right, which is known as a neural fold. So this is a plate which is formed first, and this plate, it converges and it gives rise to a fold, right, and eventually it gives rise to a tube. This is the upper epidermis. So you can see that the neural tube is a part of, like, it is formed from the epidermis, right? So these are the crest cells which detach from the topmost layer of the neural tube and they migrate and gives rise to various structures, right? Now, the next topic is the development of face. Okay. Now, this obviously the development of face is the most important topic, right? We'll be reading about pharyngeal arches and pouches. What I'm going to do is, along with these pharyngeal arches and pouches, we'll be discussing about all the derivatives of the nerves, all the derivatives of the muscles. Now, how the muscles are, why these muscles, particular muscles are supplied by this particular nerve, we'll be able to understand through the branchial arches and pouches or the pharyngeal arches or pouches, right? So this is a very important concept. We have to be very attentive again. And I would say that I'll be asking a lot of questions from this topic because it is very, very important. Okay. Now, end of the third week. Now here, the third week is ending. That mesoderm separates ecto and endo, except for the cloacal membrane in the caudal region and procaudal plate in the cranial region, where they are tightly adherent. I am a little bit faster in some areas of my teaching because the topics which are very important, I'll be focusing mainly on those topics because there is no end to learning thing, right? Learning curve. But whatever is important, for AFK, ADAT, and NEET exam, MDS exam, so I'll be discussing all those things. And when we'll be going for a test at the end of the session, at the end of every subject, we'll be having a test. In that test, what I have done is I have taken questions from different areas, widespread areas, and the important questions will be discussed. But yes, there'll be some questions, because I cannot teach everything in this short span of time. There'll be some questions which will be out of this teaching thing, but still you'll be able to answer them based on the concepts which we are learning, right? And based on the knowledge, basic knowledge. Also, Neha and Aman sir, what we are going to do is we are going to learn like anatomy first, then physiology, pathology, microbiology. So what I usually do is I club all of them once we are done with like three subjects. For example, once we are done with anatomy and physiology, I'll club both of them. Then we'll be doing pathology. Then I'll club all three of them. So there'll be questions wherein the pathology related to, for example, there is a particular organ like kidney. So physiology related to kidney, then pathology related to kidney, and anatomy related to kidney. So we'll do all those three things together. But before that, we have to have understanding of the basic concepts of anatomy, basic concepts of pathology, basic concepts of physiology. Once we do that, you will be able to correlate them. Once we are ready to correlate them, then we'll be able to solve questions which are based on like clinical scenarios. Sometimes they give you questions wherein I have two or three questions today, wherein they just talk about that you get a patient having Wegener's granulomatosis, right? Having some, bleeding from the nose. So it is a connective tissue disorder. It's a blood disorder, wherein the blood vessels, they have issues. So what happens is the patients, they get bleeding from the nose. So sometimes in our clinical practice, we can get a patient having bleeding from the nose. So we have to understand all the basics of various pathologies or various diseases which are related to head and neck region. They have complications. So any disease of anywhere in the body, if it has any complication in the head and neck region, and head and neck region is definitely important because we have brain sitting on the top, right? So we have to understand all these concepts, right? So we'll be reading all these things in detail so that we have a basic understanding and a wide understanding. Okay. Now let's see the gut formation of the gut. So gut is formed here. If you see that the embryonic disc folds in two planes, which we have already seen, right? It gives rise to a C-shaped embryo. So this is a C-shaped embryo which is formed, and the endodermal lined yolk sac gives rise to a primitive gut. So this endodermal lined yolk sac, it gives rise to the primitive gut, which is divided into foregut, hindgut, and midgut, right? Sorry, foregut, midgut, and hindgut. Okay. Now we have to learn the structures which are developing from foregut, midgut, and hindgut. Okay. Let's see what those structures are developed from foregut, midgut, and hindgut. Okay. Now the structures developed from foregut are pharynx, pharyngeal pouches, first part of duodenum, and esophagus. So you can see P pharynx, P pharyngeal pouches, first part, that is P, of duodenum, and esophagus. And esophagus. Just give me 1 second. Okay, sorry for the interruption. Okay. Now we have the derivatives of foregut, then we have the derivatives of the midgut. Now midgut, the rest of duodenum. So the first part of duodenum is foregut, rest of the duodenum, the entire small intestine, and ascending and transverse colon of the large intestine. So basically all the small intestine is derived from midgut. Hindgut, the descending colon and terminal parts of alimentary canal. So all the rest, the lower part of the gut is formed by hindgut. That is why it is known as hindgut. Mid is the middle part, foregut is the front part. So pharynx, pharyngeal pouches, first part of the duodenum, and esophagus are derived from foregut, right? Anybody who can tell me all these three are derivatives of which germ layer? Like germ layer, they are ectodermal, endodermal, or mesodermal? Neha?
Endodermal.
Endodermal. Very nice. They are all endodermal.
Endodermal.
So entire gut is formed from endo, if you remember here. Okay. Now this endoderm, if you see, right? So trachea, bronchi, lungs, epithelium of gastrointestinal tract. Okay. So the gastrointestinal tract is a derivative of endoderm. Okay. Now this is a very important concept, whereas at the cephalic end. Okay. So if you see, what is cephalic end, Neha?
Cephalic end is like cephalo is for head. He used.
Yeah, very nice.
Yeah.
So where the brain is developing, right? So
Yeah.
that is the cephalic end or the cephalic end. Okay. Now, if you see, where is my pointer? Sorry. Yeah, it's here. Okay. So this is the cephalic end, and the lower here, this is the cardiac bulge. So here what is happening here, it is kind of a folded embryo, right? So here the brain is there, the brain will develop, and here the cardiac bulge or the heart is developing, right? So if I have like brain here and my heart is here, so if I just bend like this, okay, so this is bending. So the like the embryo is like bended embryo, right? Folded embryo, sorry, right? So what happens at the cephalic end or the cephalic end, the foregut is temporarily bound by ectodermal endodermal membrane. So if you see here, there is a membrane here. This membrane is ectodermal endodermal membrane, which is known as buccopharyngeal membrane. What is buccopharyngeal membrane? This is the stomatodeum or the primitive oral cavity or the primitive mouth, and this is the foregut. So now you see when you eat something, it goes directly in the gut or the stomach, right? It goes in the stomach because we have an opening. It's open. But when it is developing, it is not open. There is a membrane which is known as buccopharyngeal membrane, which separates the stomatodeum or the primitive oral cavity from the gut. This membrane is called as buccopharyngeal membrane, and it is derived, it is a derivative, and it is endodermal and ectodermal line. So there is no mesoderm. Okay, so in the fourth week, what happens during the fourth week? The buccopharyngeal membrane ruptures, establishing an open connection between stomatodeum and foregut. So this is very important. This is a very important phenomena that when this thing happens in the fourth week, what happens? That the buccopharyngeal membrane ruptures and there is a continuation of oral cavity and the foregut. So whatever we eat, it goes inside the stomach. Okay. Now, how these pharyngeal arches are developed. Okay. So during the fourth week of intrauterine life, now we see that fourth week is also very important. In the second week, everything was two, right? We were discussing about two germ layers and everything into two, right? That neuroectoderm and neural crest cells. Then we have everything two, right? In the third week, we have most of the things as three, like three germ layers, gastrulation occurred, right? In the fourth week, what is happening? The pharyngeal arches. So the phenomena of pharyngeal arches occurring in the fourth week of intrauterine life, the mesoderm of the foregut. So how these pharyngeal arches are formed? They are formed from the mesoderm of the foregut. So what happens? It becomes segmented. Okay. So there are 5 distinct bilateral mesenchymal swellings which are formed, which are also known as the branchial arches or the pharyngeal arches. Now let's see what happens, that there are 6 pairs, but only 5 pairs are discernible. However, the 5th being disappeared. Okay, so the 5th one disappears and it is not like visible after the complete formation. So if you see, there are pharyngeal arches which are formed in this foregut region. So they are the foldings of the mesoderm of the foregut. Now if you see here, it was the stomatodium. Okay, you remember stomatodium? Here it was a buccopharyngeal membrane. This is the head, this is the heart. Okay, so it is a folded embryo, like we are bent like this at this stage, right? So here there are some foldings which occur, which are known as pharyngeal arches. Now they have named some pharyngeal arches, but only 2 of them, the first one and the second one. The first one is known as the mandibular arch and the second one is known as the hyoid arch. Okay, 3, 4, 6 have no names, right? And the 5th one disappears. So we have 1, 2, 3, 4, 5th disappear, 6th. First is known as mandibular arch, second is known as hyoid arch,
Hyoid.
right? 3, 4, 6 have no name, like the no name brand of Superstore. Okay. These are the developing pharyngeal arches, which is shown. I have a beautiful video of the developing embryo. If you would like to see, I can play that video. In that video, you will be seeing that how all these structures are formed, how the folding is occurring, how the embryo is developing. If you want, I can play that video. But before that, let's see that what all structures are derived from the arches, and then we'll read the pouches and clefts. Okay. Now, every pharyngeal arch has a cartilage component, muscle component, and a vascular component. Okay, so we'll read about these. There are some nerve components, right? Now, let's see the skeletal elements of the arches. At the end of this discussion, I'll be asking questions of combined elements or the combined derivatives of all the arches, the pharyngeal arches, 1, 2, 3, 4, and 6. Okay, so be attentive. Now, what is the name of the cartilage of the first arch? It's known as Meckel's cartilage. It's known as the Meckel's cartilage. Okay. The skeletal element of the first arch are the incus and malleus. Can anybody tell me what are these incus and malleus?
Bones present in ear.
Very nice. So the three bones, malleus, incus, and stapes.
Stapes.
So the malleus and incus are formed from the first arch, pharyngeal arch, whereas the third one, which is the stapes, is formed from the second, which is known as Richard's cartilage. Okay. Now, if you see, most of the things which are developing are SSS. So you can say stapes, you can say stylet process, then stylohyoid ligament, and smaller cornu of the hyoid bone. So there are 4 S which are developed, right? Stapes, stylet process, stylohyoid ligament, and smaller cornu of the hyoid bone, right? So if you see that this is the hyoid bone, this is the body, this is the greater cornu, you see big one, and this is the smaller cornu. So the smaller cornu is formed from the second branchial arch. So these are the second branchial arch derivatives. We have the stylohyoid ligament, stylet process, and the stapes. Whereas the malleus and incus are formed from the first arch mesoderm, first pharyngeal arch. Okay, these are the second pharyngeal arch, SSSS. Okay, now we have the third pharyngeal arch, that is the greater cornu of the head bone and lower part of the body. So we have the greater cornu and lower part of the body through the third arch mesoderm. Okay. Now the fourth and sixth arch. The fourth is thyroid and laryngeal cartilage, and the sixth is cricoid cartilage. So if you see the thyroid, cricoid, they are formed from the fourth and sixth. Okay. So the thyroid through the fourth and cricoid through the sixth. Okay. Now muscles, they're very important. The muscles which are formed from the various arches. Now the first we have the Neha, can you tell me which nerve is related to the first arch? You know that?
Facial nerve.
Facial nerve?
Yeah.
How can you say it's facial nerve? Okay, what is the name of the first arch?
First pharyngeal arch.
Mandibular arch. You remember?
Mandibular arch, yeah.
What is the name of second arch?
Hyoid.
Hyoid. Okay, no worries. Let's see why we call it mandibular arch. Okay, we'll see. Okay. Can you tell me what is the muscles, like the muscles of facial expression, they are supplied by which nerve? You remember? No. No worries. We'll discuss about all these in detail. Okay. So the first arch muscles are muscles of mastication, right? Then we have mylohyoid, anterior belly of digastric. Now tensor tympani and tensor villi palatini, or TP. We call it TT and TP. Okay. These two are the derivatives of first arch pharyngeal arch. Now, when we will learn about the nerve which is passing through the first arch, then you will automatically learn that which nerve supply belongs to these particular muscles. So these pharyngeal arches are not only helping us to understand the derivatives, they're also helping us to understand or learn the nerve supply of various muscles, right? Now, the second arch is muscles of facial expression. Now again, stapedius, stylohyoid, posterior belly of digastric, and levator villi palatini. Levator villi palatini. Now, I'll just after this, the nerve, I'll open up all the nerves and exceptions together so that you will learn all the nerve supplies of all the muscles and you will never have any confusion. Okay. Now, the third arch gives rise to stylopharyngeus. The fourth is pharynx, and the sixth is larynx. Okay. Fourth is the pharynx, and the sixth is larynx. Again, the first is muscles of mastication, mylohyoid. Now, if we see anterior belly of digastric, derived from first, whereas the posterior belly from the second. Okay. So you remember one, the second one is always the posterior belly most of the times. So the anterior belly is first arch, posterior belly of digastric is second arch. Okay. Now let's read the nerves. Now, as I told you that the first arch, I was giving you a hint that the first arch is known as mandibular arch. So which nerve? The mandibular branch of the trigeminal nerve, or the mandibular nerve. Okay. So again, my question goes to Neha. What is this nerve supply of muscles of mastication? Neha, are you there?
Yeah, sorry, my audio was.
Okay.
Mandibular branch of trigeminal nerve.
Very nice. Mandibular
Yeah.
branch. Now you don't have to, you will never be confused in the nerve supply, right?
Yeah.
So all the muscles of mastication are supplied by the mandibular branch of the trigeminal nerve.
Trigeminal.
What is the nerve supply of mylohyoid nerve? Sorry, mylohyoid muscle. Okay, anterior belly of digastric.
Nerve supply, I don't.
No, look, when any nerve supply is associated with this pharyngeal arch, all the structure should also be supplied by that nerve, right? So if you see, I'll show you a picture here, right? Now, the first arch, this is the first arch, okay? The first arch, the nerve is mandibular nerve. The second arch nerve is facial nerve. The third arch nerve is glossopharyngeal nerve. The fourth arch nerve is superior laryngeal, which is a branch of vagus nerve. So we'll read about these nerves in detail. The sixth arch is recurrent laryngeal, which is also part of vagus nerve. So there is a superior laryngeal and recurrent laryngeal nerve, which are branches of the vagus nerve. Then we have glossopharyngeal, facial, and mandibular. So any structure developing here will be supplied by mandibular nerve. Any structures developing here will be supplied by facial nerve. So if I see that all the muscles of facial expressions are supplied by
facial nerve,
but there are exceptions, right? There are exceptions, which we'll learn. Right? There are some exceptions, but all the muscles are supplied by facial nerve. Stapedius, stylohyoid, posterior belly of digastric also supplied by facial nerve. Levator villi palatini is also supplied by facial nerve. But tensor tympani and tensor palatini are supplied by mandibular nerve. Okay. Okay. Can you tell me what is the nerve supply of stylopharyngeus? Let's see if you have seen that. I just showed you the nerve.
Glossopharyngeal nerve.
Very nice. Very good. Glossopharyngeal.
Yeah.
Because that is the nerve of third pharyngeal.
Yeah.
Right? Stylopharyngeal is supplied by glossopharyngeal. So you don't have to mug up anything, right? If you understand, if you know the derivatives of pharyngeal arches, you know the nerve supply of these things, right? You don't have to learn the nerve supply. Very easy, right? Okay. All the muscles of pharynx, maybe there might be an exception, are supplied by
laryngeal branch of vagus, superior laryngeal.
Very nice. And the larynx?
Recurrent laryngeal branch.
Very nice. There are
vagus nerve,
superior laryngeal and recurrent laryngeal. So let's go through this again so that you never forget this thing in future. Okay. Now, the first arch, mandibular branch. Second arch, facial nerve. Third arch, glossopharyngeal nerve. Fourth arch, vagus nerve. Which branch? Superior.
Superior laryngeal.
Now, sometimes there is a confusion. Which one is superior? Which one is recurrent? Superior means on the top, right? We have superior and inferior, right? Superior means from the top. So superior comes on the top. So it is fourth arch. Obviously, the recurrent will be sixth arch. So always remember one, the other one is opposite, right? So superior and recurrent laryngeal nerve. Okay. Now I can ask you a question. A small, let's see how does it work. Recurrent laryngeal nerve supplies
sixth pharyngeal arch, all the structures in sixth pharyngeal arch.
What were
muscles of larynx.
Very nice. So now you know the recurrent laryngeal nerve supplies the muscles of
Larynx.
Larynx. Superior laryngeal nerve supplies the muscles of?
Pharynx.
Very good. Glossopharyngeal supplies?
Stylopharyngeus.
Very good. Facial nerve supplies?
Muscles of facial expressions.
Very nice. Wonderful. And a lot of other things. Anything
Yeah,
that levator,
stapedius, stylar
villi?
high.
Yeah, very nice. SS
Yeah,
and levator villi?
levator villi
Palatine.
palantini. Yeah,
Very nice.
and
Very
posterior
good.
belly of
Posterior
digastric.
belly of digastric. Wonderful. Now you know that facial nerve supplies posterior belly of digastric, levator villi, palatine, muscles of
Yeah,
facial expression, right? Now you know a lot of things, right? It will never
yeah,
be confusing to you. Now, and nerve supplies are very important, right? We should know
yeah.
which nerves are supplying which structure, right? And we'll be reading about these nerves in detail with the structure supplying, right? Okay, mandibular nerve supplies which structures?
Muscles of mastication, mylohyoid,
Mm-hmm.
uh, interior belly of digastric,
Wonderful.
and tensor palatini and tensor
Tensor,
tympani.
yeah, yeah. Tensor tympani and tensor villi palatini.
Yeah,
Very nice, very nice. Right? So this is a very important chart, right? So the muscles of mastication, again, I'll just repeat it so that we never forget it, right? And it should be like even in your dreams, you should never forget it, right? So the pharyngeal arches, pharyngeal pouches, and pharyngeal clefts are most important topic. It should be on your fingertips, right?
these tables are actually very like these are clubbed very nicely. So
Yeah, I know. They're clubbed very nicely and they are interrelated, right? So you
yeah,
never forget things, right? So now you know the nerve supply, okay, and you know the muscles. You also know the bones, the skeletal elements, right?
yeah,
Okay. Now let's see the arteries. Okay. Now the artery which is associated with the first pharyngeal arch. Okay. It is the external carotid artery and maxillary artery.
maxillary.
Now, I'll just open up a small diagram, okay, of the arteries. With that diagram, you will understand in one go. It's a beautiful diagram, okay? Let me just open that. You will never forget the nerves, arteries, okay? Okay, let's keep it this way. Now let me open up I have a picture of that. Let me see where it is. Yeah. Are you able to see this picture?
Yes.
Okay, good. Now, if you see that there is, sorry, my bad, there is arch of, yeah, okay. Now let me show you. From this arch, right, on the left side, we have left subclavian artery and left common carotid artery, okay. But on the right side, they don't arise directly from the arch of aorta. They arise through a trunk, which is known as the brachiocephalic. I call it cephalic, not cephalic. Okay, so you can call it cephalic, brachiocephalic trunk. You are comfortable with cephalic, right?
Yeah.
Okay, so let's call it cephalic. Now, brachiocephalic trunk. Okay, from this brachiocephalic trunk, there are two branches: common carotid and tell me, right
Right
subclavian.
subclavian.
Look, on the left side, if you see, this is the left, this is the right. Okay, on the left side, the directly arising branches are common carotid
Common
and
carotid. Left
subclavian.
subclavian.
But here the common carotid and subclavian are derived from brachiocephalic trunk, not directly. This is a very important concept to understand and learn, that how this common carotid on the right side occurring or starts and how the common carotid on the left side starts. Right. So on my left side, if I see the arch of aorta, right, on my left side, the common carotid is arising directly, whereas on the right side, it is arising from the brachiocephalic trunk. Now, after arising, the common carotid artery divides into external and internal carotid, as you know. right, at the level of thyroid cartilage, upper border of the thyroid cartilage. Sometimes there is a question, I have seen this question in NEET exam many times, that where this division occurs of the common carotid artery into external carotid and internal carotid artery. Now, the right common carotid artery divides into right external carotid artery and right internal carotid artery. Okay. Now, the external carotid artery is the chief artery of supply to the structures in front of the neck and in the face, right? So, the various branches of the external carotid artery are: anteriorly, we have superior thyroid, lingual, facial. Posteriorly, we have occipital and posterior auricular. Medially, we have ascending pharyngeal. And terminally, we have maxillary and superficial temporal. So, if you are able to see my face, right?
Yeah.
Okay. Now, if you see, I'll show you a trick how to remember this external carotid artery branches. Now, if you see, there are three anterior branches, right? So, three anterior branches are occurring like this, right? Right. So, the three anterior branches are superior thyroid, lingual, and facial. Facial is going obviously in the face, right? Lingual in the tongue. So, superior thyroid, lingual, facial, three anterior branches of the external carotid. So, the arch of aorta from the arch of aorta, what is happening? The common carotid of the left and the right side. So, right. So, the common carotid which is coming here, it divides into external carotid and internal carotid. The internal carotid goes inside through the jugular foramen into the brain. Okay. And the internal carotid supplies the various structures of the brain. The external carotid artery, which comes outside here, right, at the upper border of the thyroid cartilage, it divides the common carotid into external and internal. Internal goes inside, external supplies. So there are three branches anteriorly, which are the facial, lingual, and superior thyroid.
Thyroid.
Okay. Then we have posteriorly two branches, occipital and posterior auricular. So this is the occipital bone and this is the auricle. So posteriorly we have two, occipital and posterior auricular behind the auricle. Then we have medial. You can say medial is inside. So it is ascending pharyngeal. And then we have terminal. Terminal branches are divided into superficial temporal and maxillary artery. Right? Superficial temporal, this is the temple region. If you see, this is the temple region, the temporalis bone, squamous part of the temporal bone. So this temporal region, which artery is there?
Maxillary.
No, superficial temporal. Temporal, no?
Okay.
Superficial temporal, and here there is maxillary artery, which supplies the various structures of the maxilla. Right? So I'll just close this diagram so that you don't cheat. Yes, right?
Yeah.
Now I'll be asking questions. Okay. Now what is happening from the arch of aorta, right? What is happening? Neha,
Yeah. From
there
arch
is
of
like right and left.
right. Yeah.
On the right side, it is divided into,
Left and right carotid.
yeah.
I'm
Right.
sorry, there's some audio
Yes,
disturbance.
yes. I'm sorry. Okay. So on the right side, it is divided into, you remember on the left side, it is arising directly from the arch of aorta, the common carotid. On the right side, it rises through the which trunk?
Brachiocephalic trunk, which
Yeah,
divides into
brachiocephalic
right
trunk. Yes.
common carotid artery and right subclavian artery.
Wonderful. After that, the common carotid artery, when it comes at the upper level of the thyroid, divides into
Yeah.
external carotid and internal
External.
carotid.
Yeah.
Right? Internal, first I'll repeat and then you will repeat. Okay. Let's see
Okay.
how much you remember. Okay. So I'm just giving you a review. The internal carotid goes inside the brain through the internal jugular foramen, goes into the brain. Right? The external carotid artery, right? It goes on the outer side and it supplies the various structures. So it has three anterior branches. Which one? Superior
Superior
thyroid,
thyroid,
lingual,
lingual,
and
and
facial.
facial.
Two posterior, occipital and
Occipital and
posterior auricular,
postauricular.
right?
Yeah.
Then medial, ascending pharyngeal,
Yeah.
and two terminal, superficial temporal, temple bone, and
Maxillary.
maxillary. Again, external carotid artery divided into three anterior branches: superior thyroid, lingual, and
Lingual and facial.
facial. Posteriorly, we have occipital and
Occipital and
posterior
posterior
auricular.
auricular.
Medially, we have ascending,
Ascending pharyngeal.
and terminal, we have superficial temporal and
Maxillary
very nice. Now you know all the branches of external carotid
artery.
artery, right? Now you know all the branches of external carotid artery. Now, we are not going to learn all the arteries right now. I just told you about these arteries because they are very, very important and you get confused with the arterial supply. Okay, now let's go back to our topic. Let's stick to the topic because if I go out of the topic, then I go completely out of the topic, right? I don't want that. Okay, so let's go. Okay, arterial supply. Now we see that the first arch derivative are external carotid artery and maxillary artery. Okay. Can you tell me maxillary artery is a branch of?
Terminal.
Yes, terminal branch of external carotid artery. So he can also write external carotid artery with its terminal branch maxillary artery, right?
Hmm.
Second is this tapedial artery and small contribution to the facial artery. So technically, facial artery is also a branch of
Anterior,
anterior
anterior part
division
of
of the
external.
external carotid artery.
Yeah.
Now, third, proximal 1/3 of the internal carotid artery. Now, the internal carotid artery which goes in the brain, right? So the third arch is related to that, small contribution to the common carotid artery. Fourth is arch of aorta and proximal part of the subclavian artery. You remember subclavian artery?
Yeah.
Derived from arch of aorta and the proximal part of both pulmonary arteries and most of the ductus arteriosus. Okay. So these are the arterial supplies of the various pharyngeal arches. Okay. Now, what are pharyngeal pouches and groups? Now, before learning about them, let's see this picture, right? This is a very informative picture. Okay. Now, if you see this outer layer, this is ectodermal. Okay. Neha, do you remember that the, ectodermal, I would say pharyngeal arches, they develop in the foregut region, right? So they develop in the mesodermal, they are the mesodermal thickenings. So in the foregut region, the mesodermal thickenings, we have an ectoderm and endoderm and mesoderm. And this is the site of buccopharyngeal membrane. If you remember, this buccopharyngeal membrane was ruptured. Okay, can you tell me buccopharyngeal membrane is formed of which two layers? You need to unmute, Neha.
I'm just recalling.
Okay. I'll just give you a hint. I told you that
It was,
yeah.
yeah.
Mhm. I'll give you a hint that if you remember this structure, like there was a head fold,
Folded. Yeah.
then there was a tail fold here, and there the foregut, the pharyngeal arches were developed. There was a membrane here, which I told you that it divides
Foregut
the
and
stomatodeum and
stomatium.
foregut, right? So
Yeah.
this membrane was formed from endo and ecto, ecto-endo. There
Yeah.
was no mesoderm in that, right? So if you
Yeah.
see in this picture, the black ectoderm dot 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 dot, the pink endoderm dot dot dot. There is no black dots in between. There is no mesoderm, right? So this is the
Yeah.
site of buccopharyngeal membrane which ruptures, right, from the
Okay.
foregut, right? So there is a continuation from the oral cavity now. So stomatodium is continuation with the oral, with the foregut region. Now the foregut region is divided into various structures which are known as pharyngeal arches. Now these pharyngeal arches, they are composed of outside, they are composed of ectoderm, inside they are composed of endoderm, and in
Endoderm.
between there is mesoderm, right?
Yeah.
So if you see the arrows, they have always mentioned in the mesoderm. This is first arch, second arch, third arch, fourth arch, and sixth arch, because pharyngeal arches are the mesodermal thickenings. Now, there are some pouches which are formed from endoderm. So if you see the endoderm, there are some pouches which are formed inside. So there are first pouch, second pouch, third pouch, and fourth pouch. And outside ectoderm, we call it cleft. So this is known as ectodermal cleft. First cleft, second cleft, third cleft, and fourth cleft. Did you understand?
Yeah.
Sure?
Yes.
Any confusion?
No.
Any doubt?
No.
No? Okay. Now, the first pharyngeal groove persists, whereas while its ventral end is obliterated, its dorsal end deepens to form the external acoustic meatus. Okay. So what is the pharyngeal groove or the pharyngeal cleft, which is ectodermal derived? Okay. So the outside we have the clefts or the grooves, and inside we have the pouches. Now the second, third, and fourth pharyngeal groove becomes obliterated by the caudal overgrowth of the second pharyngeal arch, which is known as hyoid operculum, which provides a smooth contour. So we'll see how this is formed. Look here. Okay. Now if you see, he has shown a red line here, right? So they are obliterated. So I can say that the external acoustic meatus is formed from the first pharyngeal groove, right? So from which end? The dorsal end. So if I ask you a question that the external acoustic meatus is developed from which structure? It is developed from the dorsal end of the first pharyngeal cleft or the first pharyngeal groove. Okay?
Yeah.
Sure? Now you know from where the external acoustic meatus develops, right? Now let's see the fate of endodermal pouches. Now, if you see that inside there are some pouches. From the first endodermal pouch, what develops is the diverticulum called the tubotympanic recess, right? The middle ear and the auditory tube. So we can say the middle ear and the auditory tube are derivatives of endodermal pouch. Which one? First. Now, a simple question. Sometimes there is they twist the questions, right? The concepts are same, the questions are twisted. Sometimes they ask the auditory tube is a derivative of, it is an ectoderm, endoderm, mesoderm, none of the above. So this is a
Endoderm.
endodermal derivative, right? Middle ear and auditory tube developed from the first endodermal pouch. They're endodermal derivatives. Second pouch gives rise to palatine tonsil. Again, it is related to head and neck. So very important. Third pouch, inferior parathyroid gland. Now here there is a catch. Always remember, यहाँ पे उल्टा हो गया. Inferior ऊपर आ गया, superior नीचे चला गया. तो याद रखना जब पाउच बने तो उल्टा हो गया, राइट? क्योंकि अंदर थे ना पाउच, तो वो उल्टा हो गया. So the third pouch gives rise to inferior parathyroid gland and thymus, and the fourth pouch gives rise to superior parathyroid gland. So this is a very confusing derivative where sometimes we get confused. Never ever get confused in this question that the third pouch gives rise to inferior, whereas the fourth pouch gives rise to superior parathyroid gland. Okay, do you want to take a break?
Yeah, we can.
Huh? You want, or we can continue? Like if
I'm okay. Like,
you're okay?
yeah.
Okay. If you're okay, I'm okay.
We can take it 7. I'm sorry, like in 20 minutes.
20
It will
minutes?
be 2
Okay.
hours. Yeah.
Okay, okay. Yes, anytime. Like whenever you want to take a break, let me know. Okay.
Sure. Thank you.
I have a habit of teaching for like 10 hours, so I don't mind teaching you continuously. Okay.
Continuously.
Eh, Because this is like a little bit of, I would say, a little bit intense, right? Because embryology is a little bit difficult to understand. But this is this thing I found like the simplest way to teach embryology, because understanding structures like syncytiotrophoblast or like understanding buccopharyngeal membrane, when I was in my college time, I wasn't able to understand any of these structures, to be honest. I couldn't understand. Like when I was even taught, like I wasn't able to understand a lot. But now I have good understanding because these 3D, pictures which have come into the play situation now, they're very informative, right?
Yeah.
Okay. Now the basic morphology of the face and the mouth is created between 4th and 10th week. Okay. So what we are going to do now is we'll be completing embryology, the full topic, and then we'll start the next topic after the break. Okay.
Sure.
Okay, there are 5 prominences which are developed. One is the unpaired frontonasal process. 2 maxillary swellings and 2 mandibular swellings of the first pharyngeal arch. Now, entire face, I would say, is developed only from the first pharyngeal arch, right? The buccopharyngeal membrane breaks on about the 27th day, right? Now you know what is buccopharyngeal membrane. Now let's see the next. Now there is a frontonasal prominence. There is a nasal placote which is formed here. This is the disintegrated buccopharyngeal membrane. These are the maxillary swellings. These are the mandibular swellings. And this is the second pharyngeal arch. So this is the first pharyngeal arch, right? This is the first pharyngeal arch and this is the second pharyngeal arch. Okay. Now let me change my pen. Now, after the formation of the head fold, 2 prominent bulging are formed. Now, as I told you that there is a developing brain and there is a pericardium. So if you see, if you remember that picture like this, right? And like this, here the foldings develop. So here is the formation of heart and here is the developing brain, right? The embryo is folded. Okay, it is folded. Now they are separated by stomatodium. So this, if you remember this picture, this is a very good picture. So this is the forebrain, developing forebrain, and this is the developing heart or the pericardium. This is the primitive mouth. This is the buccopharyngeal membrane, which ruptures and forms an opening between the primitive mouth and the foregut. This is the mesenchyme, which is covering the forebrain. Now, mesoderm covering the forebrain forms a downward projection overlapping the stomatodium. So how this frontonasal process forms is that the mesoderm, which is covering the forebrain, right, it forms a projection here, right? So now if you see in this picture that here the pharyngeal arches were formed, right? Now from the first pharyngeal arch, everything develops, right? Now this frontonasal process is from the mesoderm, which is above the forebrain and gives a projection. So this frontonasal process is formed here. Mandibular arch plays a role in the development of the nasomaxillary region. The mandibular arch of both sides from the lateral wall form the lateral wall of the stomatodium, and maxillary process grows ventromedially cranial to the main part. So let's see. Now stomatodium or stomodium, that is the primitive oral cavity, is overlapped above by the frontal process, the frontonasal process, below by the mandibular, on either sides by the maxillary. So there are, if you see, there is a mandibular arch. This is the first pharyngeal arch. From that, there are 2 processes which are developed, the mandibular process and the maxillary process. And this is the frontonasal process. Okay. Again, frontonasal process, stomatodium, first arch, which divides into maxillary and mandibular. Now, development of the nose. So simple, there are 2 localized thickenings. They are known as nasal placotes. So these are the nasal placotes. This is the lens placote and these are the nasal placote. Now, if you see that the lens placote is on the sides, right? But our eyes are in front. So what happens that during the merging of these various structures, the eyes from the side, they go in the front. Okay. So if you see, it is on the side. This is the nasal pit because the nasal placote finally forms a nasal pit. There are 2 processes which are known as medial nasal process and lateral nasal process. So how it works is they all, when they fuse first with the lateral nasal process and then with the medial nasal process. In the middle, we have the frontonasal process. So in the 6th week, ectoderm at the center of each nasal placote invaginates to form the oval nasal pits. Formation of the nasal pits divides the frontonasal process into mesial and lateral nasal process, as I told you. Okay. Nasal passages are just formed by the deepening of the nasal pits. Okay. Now the lower lip, the right and left mandibular processes, right? So these right and left mandibular processes, they grow towards each other and fuse to form the lower lip and lower jaw. This is a little bit monotonous, not very interesting, but we have to learn, we have to know that what all processes are formed. Okay? So I'll be a little bit fast. Upper lip. Now, this is important that each maxillary process now grows medially and fuses first with the lateral nasal process, and medial and lateral also fuse with each other. So nasal pits are cut off from the stomatodium. So if you see that this is the primitive mouth which is formed. This is the frontonasal process, and these are the maxillary process fuses with the lateral nasal process here. So this was the maxillary process. It fuses with the lateral nasal process. Okay. Maxillary process undergo considerable growth. Stomatoderm is now bounded by upper lip, which is derived as follows. Now, the upper lip is derived as follows. The mesodermal basis of the lateral part of the lip is formed from the maxillary process. The overlying skin, obviously, overlying skin is derived from ectoderm. Okay, so the overlying skin, the outer skin is ectodermal derivative. By the 10th week, the mesodermal basis of the medial part, we call it philtrum, is formed by the intermaxillary process. So we can say that the lower lip is formed totally from the mandibular process, but the upper lip, we have the lateral part of the upper lip and the middle part of the upper lip. The lateral part of the upper lip is formed from the maxillary process, whereas the medial part is formed from the intermaxillary process. The maxillary process overgrows this mesoderm to meet the opposite maxillary process. As a result, the skin of the entire lip is innervated by maxillary nerves. Development of cheek. It has, I didn't find any question related to the development of cheek and its derivatives. Development of eye, you just have to remember that there is a ectodermal thickening which is known as the lens placode. Okay, similar to a nasal placode. Okay. So, and with the narrowing, as I told you, that eye, they come to face forward with the narrowing of the frontonasal process. Okay. Now, development of ear. Now, let's see that external ear is formed from first ectodermal cleft. You remember, Neha, you remember when we were talking about the first ectodermal groove or the cleft? What was?
Yeah, cleft over from the outer, like outer layer.
Yeah, so external auditory meatus, right? If you remember, formed from
Yes,
the first ectodermal
first ectoderm.
cleft. Then a series of mesodermal thickenings, they are known as hillocks or tubercles, right? They appear on the first and second arches where they join this cleft and forms the auricle. So the auricle, this auricle is formed from hillocks or tubercles. They appear on the first and second arch, right? They join this cleft. So the external auditory meatus is this. This auricle is formed from the first and second arches. Okay. And they are known as hillocks or tubercles. Okay. Now, development of tongue is very important because there are a lot of questions which are related to the development of tongue. So we'll discuss this a little bit slower and we'll understand, right? So in the development of tongue, we have the involvement of first arch, second arch, third arch, fourth arch, and some of the occipital somite mesoderm. Let's see what is it. Now, the first arch mesoderm, right? The first arch mesoderm gives rise to a median swelling, which is known as tuberculum impar or median tongue bud. Okay. So there is a medial swelling, this one. This is known as tuberculum impar or the medial tongue bud, and there is a distal tongue bud. So there are two lateral swellings or distal tongue buds. So there are two lateral swellings and one medial swelling, okay, which are derived from the, if you see this yellow is the first pharyngeal arch. If you see from the second pharyngeal arch, there is a formation of popula. From the third and fourth pharyngeal arches, there is formation of hypobranchial eminence, right? Now from here only, you might be wondering that these are these are the structures which are developed through the tongue. And if you remember the nerve supply, right, of these arches, you'll be able to learn the nerve supply of the tongue, right? Because now you know that how the tongue is developed into various sections. So I'll just ask you a question when we go ahead, okay? Posterior 1/3 of the tongue, we have the second arch and third and fourth arch. So it means that anterior two-third of the tongue is derived from or is supplied by which nerve, Neha? Neha, are you there? Neha, are you there?
Yes.
Okay. Yes,
So,
Neha.
yeah, interior two-third of the tongue, the mandibular branch of
Yes,
trigeminal
mandibular
nerve.
branch of the trigeminal nerve.
Trigeminal nerve.
Okay, can you tell me, like, we have the third and fourth arch here, right? And we have the second arch. We'll go ahead and then we'll discuss. Now let's see that how the tongue is formed. Now, this is a very important concept to learn. So I would say never ever forget these, three things. Okay, they are very important. There are a lot of questions based on this concept. Okay, whenever I say a lot of questions, it means these are the favorite topics of the examiners, right? Also, there are some released questions of AFK, right? We'll just go through all those release questions as well so that we have an idea that where they are mainly focusing. In the next session, I'll also tell you like what is the weightage of different subjects in AFK so that we have a decent idea. Okay. So anterior two-third, it's derived from tuberculum impar and two lingual swellings. The posterior one-third is cranial part of the hypobranchial eminence, third arch mesoderm, and the fourth arch mesoderm gives rise to the posterior most part. So in the anterior two-third, we have the involvement of first and second arch as well. In the posterior one-third, we have the involvement of third arch. And in the posterior most part, we have the involvement of the fourth arch. Can you tell me which nerve is related to the third arch?
Glossopharyngeal.
Pharyngeal. Which nerve is related to first? Mandibular. The second is
Facial.
facial. So, and in that, if especially in the tongue, the branch of the facial nerve which is related is known as cauda tympani. We will discuss in future. Okay, that cauda tympani nerve is related to the tongue. Okay. Now, immediately behind the tuberculum impart, the epithelium proliferates to form a downward growth from which the thyroid gland develops. Okay. Now, the site of this downward growth is marked by depression called as foramen cecum. Okay. We'll discuss about foramen cecum when we'll be doing the skull. Okay. I'll tell you about that during that. Okay. Now, musculature of the tongue. All the muscles of tongue are derived from myotomes of the occipital somite except palatoglossus. Palatoglossus is innervated by the pharyngeal plexus of the vagus nerve. Now, let's understand that all the muscles of tongue, right, they're derived from myotomes of the occipital somites except palatoglossus. So one of the muscle is supplied by vagus nerve. So we'll see in detail. Just give me 1 minute, okay? Now, anterior two-third of the tongue. If you see the anterior two-third of the tongue should have which two nerve supplies? They are derived from first and second branchial arches. Neha.
They are supplied by mandibular branch of trigeminal and facial nerve.
Okay. So if you see from the mandibular branch of the trigeminal nerve, we have a special branch which is known as lingual branch.
Lingual.
Okay. So the sensory receptors, the lingual branch of the mandibular nerve of the trigeminal nerve, they take the sensations. The taste buds, we have the cauda tympani, okay, which is a branch of
Facial
nerve, cauda tympani. Now, posterior one-third of the tongue, we have the glossopharyngeal. Why glossopharyngeal? Because it is derived from
third pharyngeal arch.
Now I'll tell you a small trick just to remember things. If you forget the structure or the nerve related to third brachial arch or vice versa, you can just remember, like sometimes, what you remember is that posterior one-third of the tongue was supplied by glossopharyngeal, right? And I remember that posterior one-third was supplied by third brachial arch. So the nerve which is associated with third brachial arch should be glossopharyngeal, or vice versa. If you remember that posterior one-third is derived from third brachial arch, and I know it is derived from glossopharyngeal. So the nerve which is associated should be glossopharyngeal. Are you getting my point?
Yeah.
Right? So the sensory nerve which is supplied by, which is associated with the posterior one-third of the tongue is the glossopharyngeal nerve. Now, the posterior most part of the tongue should be supplied by the superior laryngeal. Why? Because it is derived
Fourth
from
arch.
the. Very nice. Now, development of palate. Initially, a common oronasal cavity occurs, which is bounded anteriorly by a primary palate. So let's see how the palate is developed. Okay. So if you see, this is, sorry, where is my, yeah, it's here. Okay. Now, you remember the frontonasal process, right? From here, there is formation of premaxilla. These are the right and the left maxillary processes. Here, there is a formation of, first, there is a formation of primitive palate, right? So if you see, this is the primitive mouth. These are the right and the left maxillary, the upper processes. Now they fuse together. This is the nasal septum which is formed. This is the nasal cavity. And then there are some processes which develop from the maxillary process, which are known as the palatal processes, right? How they are fused, if you see that, yeah. So now this part is the premaxilla. They are formed from the primitive palate or the frontonasal process. Now you saw those two processes of the maxillary process, these ones, right? So these two fuse to form the maxillary process, this area, which is known as the hard palate. And then where there's no fusion, this is called as the soft palate. Okay. So palatal processes are derived from maxillary process, right? They are the extensions of maxillary process, right? Now, we are not going to read about the elevation of palatal shells because this is something which is related to histology and other structures, right? So let's see that how the secondary palate is formed. Now, each palatal process fuses with the primary palate, okay? The two palatal processes fuse with each other in the midline, begins anteriorly and proceeds posteriorly. So they are fusing with each other. If you see, the palatal processes are fusing with each other and also with this primitive palatal process. So they all fuse together. Okay. So here we are ending the embryology part. Okay.